Okay, good evening, everyone. Once again, a very warm welcome to all of you to the Early Childhood Education Public Lecture Series organized by SUSS. My name is Melissa, and I'm an early childhood faculty member here at SUSS. We first launched this lecture series in 2022 to bring together researchers, practitioners, and policy makers to share perspectives on emerging issues that shape early childhood education and care in Singapore. And we took a short break to host our in-person early childhood education conference and other events in the last 2 years. And we're delighted to return this year with another online series featuring both local and overseas scholars and practitioners. So before we begin, a few housekeeping notes. The session today will be recorded so that we can actually share it later with colleagues who were not able to join us in session today. And we request that you keep all your microphones muted during the presentation to minimize the background noise. You may use the chat box to post your reflections or questions at any time. And we'll also have a Q&A segment at the end where you can raise your hand and unmute yourself to ask questions directly or put it inside the chat box and I will read it out. So today's session is titled Physical Discipline in Singapore, Prevalence, Perspectives and Experiences of Parents and Young Adults. So we have with us the privilege of Dr. Charlene Foo, who is the head of the research unit, and Ms. Goh-Karssen, manager of the Advocacy unit from Singapore Children's Society. So Singapore Children's Society has long championed the well-being of children and youth in Singapore through its 10 service centers island-wide. Its research and advocacy department plays a crucial role in conducting evidence-based studies and advocating for the prevention of child abuse and neglect, while promoting positive parenting practices. In collaboration with Yale and US College, the team embarked on a mixed method study that examined parental disciplinary practices in Singapore with a special focus on physical discipline. This evening, Dr. Foo will share about prevalence, patterns, and experiences of such practices, as well as their impact on parent-child relationships, emotional regulation, and self-esteem among young adults. After which, Ms. Goh will also discuss the insights that can guide public education efforts towards nurturing positive parenting cultures in Singapore. So without further ado, please join me in welcoming Dr. Charlene Foo and Ms. Goh-Karssen from Singapore Children's Society. Charlene and Karssen, over to you.
Thank you very much for inviting us for this session and for everyone who came and joined us this evening. So I'm Guan and Charlene is over there. So we're here to share a little bit, and I'll start off before passing the time to Charlene. So a Children's Society was formed actually just after World War II, and we are operating services in 4 categories. So in vulnerable children and youth, we operate a children's residential home. Under children and youth services, we have Twinkle Friend, the helpline and chatline for primary school children. We also run children's programs, youth drop-in centers. We also have Yishun Family Service Center, and upcoming, we are also working with other agencies to co-create a family wellness space at Connect City Square Mall. And here we are with Research Advocacy Department sharing today's session. It's a very concerted effort to go into this issue of physical discipline. So what we'll do is that Charlene will share about the study background, aims, methodology, and key findings. And then I'll come back for the last section, from insights to action. We also want to thank you for doing the poll so that we kind of have a sense of who our audience is today and our curious question of whether you have been physically disciplined as a child. Yeah. So as Charlene shares some of the findings, right, especially maybe for those who have been experienced that as a child, you may relate to some of the experiences there. Yeah, and we also hope that, because we know that this can be a sensitive topic, because all of us have come with different experiences and opinions. So we just hope that everyone can come with an open mind, open heart to just kind of like explore more about this topic. So over to you, Charlene.
Thanks, Guan. So I also wanted to say a big thank you to everyone for making time to listen to us share about our research findings. So I know it's a Friday night, so I'm very impressed by the number of people who have shown up to listen to us actually. So maybe I'll just dive straight in to get us started. So in this study, we really wanted to understand the different approaches parents took to disciplining their children. Our intention was to primarily study physical discipline, but we also didn't want to study physical discipline purely in isolation. We wanted to understand how parents used different types of discipline method and what is the range of methods that parents use. So what we focus on in this study was primarily physical discipline, but we also looked at non-physical discipline. So what we think of as maybe some positive discipline strategies, such as reasoning, as well as psychological discipline. So this psychological discipline would then refer to where a child is made to believe that they have to behave a certain way in order for parents to continue loving them, right? Or it could be including things like shaming the child, calling the child names. What we know from the literature is that physical discipline does have negative long-term consequences. So these are a whole bunch of long-term consequences, right? So it could contribute to increased aggression, antisocial behaviors, poor mental health in childhood and subsequently in adulthood. There are also negative consequences with psychological discipline, whereas non-physical discipline is typically associated with more positive outcomes, right? I think this is important to highlight here also that when we were considering doing this study, or even before starting this study, we were very conscious that we wanted to understand the impact of physical discipline within the Singaporean context as well. One critique and pushback we hear very often is that, oh, a lot of this study is done, a lot of such studies on physical discipline are done overseas in so-called Western countries with different cultural values. So even if studies there show that there are negative consequences, that may not apply in Singapore. And so that was something that we wanted to unpack a little bit more with this study as well. Internationally, physical punishment is currently banned in 68 countries in the world. Many other states have not done so. And we all often hear that, physical discipline is a part of Chinese culture, it's part of Asian culture, but actually internationally, physical discipline is part of many other cultures as well, right? In Singapore, some past studies have also considered physical discipline and have shown that, like caning is sometimes linked to parental love and concern, and even if parents show high control and high warmth, physical punishment is still related to child aggression in the longer run, right? So we do have some early evidence within the Singapore context that shows negative consequences of physical discipline as well. So part of why we started this study was back in 2020. If you remember, if you look at the date, 30th August 2020, and the context back then was COVID, right? Everybody was in lockdown, everybody was experiencing a lot of stress. You see a lot of news reports that families are highly stressed, children are acting out, parents are multi-stressed, and then people, tempers flare up, and then parents are hitting their children and things like that, right? We wrote a commentary. Professor Ho Lai Yun was one of our board members, and we wrote a commentary encouraging people to move away from caning. And what we received so this was CNA commentary, right? You can imagine when it goes up on CNA pages, Facebook or whatever, then a lot of comments come in, right? So I think we got very, very wide-ranging kind of responses, right? So you might expect need to spank. I grew up I grew up being spanked and I was all right. If my child has problems next time, then who are you? Children's Society will take responsibility for this, so on and so forth, right? Caning is relevant as long as it's part of schools and the judicial system. So I think there were a lot of very strong opinions, and really wanted to hear more from parents. Behind that Facebook wall, you have no idea who these people are. We don't know whether these are parents themselves who feel like they have no choice but to use physical discipline, or yeah, they might have been just people looking for a platform to share their opinion, right? So we really wanted to launch a study to understand more from parents. We wanted to gather both parents and young adults' perspectives. Parents natural group that we wanted to study because they are the ones who we feel we need to engage on the topic. And for young adults, we wanted to include children's perspectives in the study, but we couldn't get around the ethics of interviewing children, and it was extremely difficult to interview children about ongoing disciplinary practices. So to work around that, we looked at young adults and asked them to do a recall of their experiences as while they were growing up, right? So we had online surveys for both the parents and young adults, and then we also followed this up with qualitative interviews. For the tool, we used an iCast. So this is the tool that I mentioned earlier. It is a child abuse and neglect screening tool, but we actually chose this tool because it had the broadest range of disciplinary methods, and it had been used and developed after extensive work done internationally. We asked for their attitudes towards physical discipline, and then for the young adults, we asked about their relationship to parents, emotional regulation, and self-esteem. So I'll come back to these and share these findings as we go. And then we did semi-structured interviews. In the interest of time and to get us through to the findings, I'm just going to quickly skip over these demographics. But one thing I would really like to highlight is that as much as we tried to get a representative sample, our demographics tend to skew towards the higher SES, right? This was probably an effect of us having done this survey online in the soon post-COVID era. So on the parents' side, I would like to point out that over 80% had at least a university degree. Okay. So with that, maybe we can get started on talking about the prevalence. What we did was to look at the results based on the different ages of the child that the parent reported for, and parents who used at least one form of discipline within each of the categories. What we found was that actually almost everybody used non-physical discipline methods, which is great, right? And we found that 30 to 40%, or about 30 to 40% of parents with younger children are using physical discipline, at least several times within the past year. Right? What we were surprised to find was that actually many parents were using psychological discipline. So it is in our pipeline to actually conduct further studies on the topic of psychological discipline, because that's something that we're very concerned about as well. So I won't be able to share much about this at the moment because we haven't been able to launch that study yet. We're still working on it. Okay. Sorry, one more thing I wanted to highlight with the demographics is that what was concerning to us is that parents, especially parents of the preschoolers, are the ones who are most likely to use physical discipline compared to the other age groups, right? And as children get older, the use of physical discipline tapers off. It was quite telling from some of the interviews when parents told us that, oh, when they get bigger, then I don't use the physical discipline anymore because they start to fight back. Some parents may say that, oh, as they get older, they're it's easier to reason with them. I can talk to them and explain to them and they get it. So there's a whole range of reasons why physical discipline tapers off with age. But I just wanted to point out that early childhood is when children are the most vulnerable to physical discipline. So this is similar data from the young adults. What we found was pretty similar also. Physical discipline is somewhere 40-60% based on recollection. Most parents do use non-physical, and again, there's quite a high rate of psychological discipline. There have been more recent studies that have been published with physical discipline data in Singapore as well. I've included some of the references here, but from these other studies as well, we see a very high rate of physical discipline being used as well, right? So I think these data were from the Gusto sample. And over 80% of children are physically disciplined, right? And it is very much an ingrained practice within the whole cultural context. So let's talk a little bit about the attitudes that parents and young adults have towards physical discipline. We asked whether they felt that physical discipline was an effective way of disciplining their child. And what was surprising to us was that an overwhelming majority felt that physical discipline is actually not effective, right? I have the data from the young adults side by side for comparison with the parents, and what was striking to us also was that generally across all of the questions, the patterns that we saw with the young adults were very similarly mirroring what we saw with the parents as well. Okay, we asked if physical discipline is an acceptable way of disciplining children, and again, more than 3/4 of the adults say it's actually not acceptable, right? If you look at the orange and blue quadrants together. And similarly for the young adults. We asked, must physical discipline be used? And again, overwhelming majority says actually it should not. Then we wanted to understand a little bit more. Do people feel like physical discipline should be banned in school, right? Because some parents cite this as a reason that they discipline their children because that's how they're disciplined at school. This was quite surprising to us that actually most parents say that physical discipline should be banned at school. And same for the young adults as well. Conversely, when we asked whether physical discipline should be banned at home, the largest proportion said no, it should not, right? So the parents feel that school shouldn't have the right to physically discipline my child, but in my own home, I should continue to be allowed to do so. And similarly for the young adults. So we wanted to link the behaviors and attitudes as well. We went back to the data and we looked at the parents who have used physical discipline frequently, right, over the past year. What we found was that actually, for those who use physical discipline very often, right, almost half of them feel that actually, even if I physically discipline my child, it's not very effective. And more than half of them also feel that even though I use it, it should not be acceptable, right? So we found this to be a quite interesting sort of puzzle, right? Parents who discipline their children using physical methods know that it's not effective, it is not acceptable, or that's how they feel towards it, but they still tend to discipline their children physically. The qualitative data was quite telling of why this was the case. It was part of the reason that we wanted to speak to parents more to unpack this puzzle a bit more. So I'll share more about that later when we get to the interview data. So earlier I mentioned that we looked at a very wide range of discipline methods, right? One of the things that we did with the data then was to also look at individual parents and what combinations of discipline methods did they use to try and understand if there were different profiles of parents. Part of the reason we wanted to do this was to understand whether this could tell us more about how to engage different parents, whether this is linked with their attitudes. And with the young adults, what we wanted to do was also to look at the profile of parenting that they experienced and how this affected their outcomes in the longer run. So I'll take everybody briefly through some of these findings. We employed a method called latent profile analysis, LPA, to kind of distinguish the different groups of the different profiles of parents, right? So the first profile of parent that we found was what we call the harsh disciplinarians. These were parents who tended to use a lot of discipline methods, and they tended to use a quite wide range of methods, right? So when you see a peak, that's the methods that they tended to use a lot. So these are the parents who use physical discipline methods quite a lot, and they also used psychological discipline quite a lot. The second group of parents we found were those who used physical discipline quite little, but tended to use more psychological discipline. The names were not very inventive, they're just low physical and high psychological discipline parents. And then the last group were people who generally used quite low physical and psychological parents, but these were parents who relied very heavily on the non-physical methods, right? With the young adults data, okay, the graph just gets more complicated, but we also found 3 profiles that are generally pretty similar to the parents' data, right? So I'll just kind of skip over these and we can talk a little bit about what were the key takeaways from having done this, right? So there were three main profiles. One is generally the harsh parents, but these tended to be quite a small proportion of parents, which is good news, right? The second group of parents tended to use less physical, quite a lot of psychological, and the third group of parents tended to be low on physical and psychological as a whole. And this was generally the case for both the parents as well as the young adults doing the recall. I think one thing that we were very glad for is that physical discipline does not always feature very strongly in parents' repertoire of discipline methods. In fact, if you recall back to the prevalence data earlier, all of the parents do use non-physical methods, right? Which means they know how, right? This is part of the repertoire. This is part of what they do on a regular basis. And certain types of discipline methods that we might be concerned about, like psychological discipline, still tend to be used by parents. And then for the young adults data, because we had also collected some outcome data for them, right? So we looked at the links between the parenting profiles that they experience and the young adult psychological outcomes. We looked at 3 things: the relationship that they have with their parents, quality of relationship with their parents, their current emotional regulation, as well as their own self-esteem. So what we found was that for young adults with parents who were harsh disciplinarians, their outcomes were the poorest, right? They had very poor parent-child relationship, and they had poor emotional regulation as well. This aligns quite well with the international literature that I shared earlier as well. For group 2, they had poorer parent-child relationship and emotional regulation and self-esteem as compared to the third group, who had the best adjustment of all, right? So our takeaway from this was really that when the harsher the discipline, as vis-a-vis how much physical discipline is used, and quite possibly psychological discipline as well, we do see poorer outcomes, right? So the harsher the parents' discipline methods are, the poorer the outcomes young adults experience in the 3 domains. So in terms of the qualitative interview, I think I'll spend some time talking about both the adults as well as the the parents as well as the young adults. I will say that for the parents, so the methodology here differs slightly, because for the parents, we had completed the survey data and then decided that we wanted to follow this up with a qualitative interview. So for the parents' data, unfortunately, the parents in the survey and the parents in the interview are a different sample. But for the young adults, we launched both phases of the study together. So young adults could actually indicate if they wanted to be contacted for and contribute as part of the interview. So for the young adults, the data are the data pool are more overlapping now. Okay. So generally speaking, for the parents group, we specifically looked for parents with younger children, because these are the age that from our survey we knew that had experience, parents with these age group, children within this age group were using physical discipline more, right? Whereas for the young adults, they were aged between 18 to 25. These were the main themes that arose from the interview, right? So what were parents' attitudes, why they use physical discipline, when they use physical discipline, and their experiences using physical discipline. In terms of attitudes, I think very brief. So in the interest of time, I'll focus on these three. But in terms of parents' attitude, I think to briefly summarize, some of them shared that they felt that they couldn't let go of using physical discipline, and that they felt that, it's a spare the rod, spoil the child kind of situation. So in terms of why parents use physical discipline, they acknowledge that it is necessary for immediate compliance. Some felt that children at a certain age have limited cognitive ability, and so pain is the clearest and fastest way to send a message about what is acceptable and not. Excuse me. Some parents have also pointed out, this is a method to ingrain the experience into their brain. So parents are very clear about the intention of why they want to use pain as a method of discipline. Parents also make reference to the fact that schools and that judicial caning is still allowed, right? So this parent also says that you have to be punished. Government also tells us that this is the way to do it, right? You have to be punished by physical means so that the message will sink in and you won't do it again, right? This parent talked about physical discipline as being 一代传一代, generation, passing from generation to generation. It's almost like a cultural legacy to them. And so they see nothing wrong, and that it's a practice that's passed on over time. As for when parents use physical discipline, I think what was very interesting to us was that parents talked about using physical discipline when it is a severe situation, when parents cannot accept the child's behavior and that the child has crossed a certain boundary. But where those boundaries lie were very different for each family. Certain behaviors that one parent might talk about would be totally different from the behaviors that a different parent would raise as concerns. Parents also talk about things like the child's age or temperament. I think temperament was quite important consideration of some of the parents. Some parents talk about, if they have multiple children, they may say something like, it depends on my child. If they're very sensitive, then physical discipline doesn't work for them because they'll get very upset and I have to spend more time to calm them down after. Whereas for a different child who is more, I don't know, stubborn or something, then physical discipline is the fastest way to get them to respond. So it was almost as though from the sharing of some of the parents, it was a matter of what was most expedient for them at a particular point in time. Some parents also said when their child doesn't show remorse, that's when they will physically discipline the child to get them to understand their wrongdoing. I think what was interesting for us was that parents also had an awareness that their mood and how much time they had played a very big part in whether they physically discipline their child or not, right? So this parent says, if I'm really stressed out, that's when I don't really think and I react to the situations. Parents have that awareness that it is a reaction. There's some other parents who talk about how it is something that they default to, and that it's as though something just snaps because they may have been disciplined physically as a child, and that's what they default to. I also want to point out one thing that we felt was quite interesting in the data, which was that this contrasts with what parents typically think of as the quote-unquote correct way to physically discipline a child. Many parents think of the correct way of physically disciplining a child as, I must be calm and collected, explain everything to my child, deliver the caning, and then kind of explain again afterwards, right? But when we ask parents to recount a recent time that they used physical discipline on their child, many parents talk about, it depends on my mood and stress, and many parents talk about something just snapping and them reacting to the situation. So that was quite an interesting contrast as well. Many parents talked about how they tried to use many other methods of disciplining their child before using physical discipline as a last resort, right? And this actually tracks very well with the prevalence data that we saw, right? Almost 100% of parents use other discipline methods, and when all else fails, then they feel like no choice, I have to get the message across, and I will use the physical methods. And because of that, and alongside that, I should say that parents overwhelmingly talk about feeling bad and guilty about having hit their child, right? So like this parent will say that I feel very regretful and I tell myself I shouldn't do that again. There was another parent that we remember because she said that, oh, after I physically disciplined my child, then I feel very bad. Now I'll buy bubble tea to share with my child and then patch up after that. So there's a very strong sense of, number one, feeling bad, but in some cases also that awareness that I need to do something to repair and mend the relationship. Okay, for the young adults, these were the general themes that came out. But I'll just focus on these two because these were the most, what we felt were the more impactful part of the data. In terms of effectiveness of parents using physical discipline, I think the message from the young adults was very clear that physical discipline, they didn't feel it was effective at all. In fact, this person talks about how all he or she remembers learning is where each parent's boundaries are. And then you learn to kind of get away with things without crossing those boundaries. And that very clear awareness that each parent has different boundaries, right? But in terms of the instructive value, did this person learn the values or the lessons that the parents were trying to teach? No, that wasn't the case. This person talks about immediately complying to whatever the parent asks because the point on the child's perspective was just to avoid the pain that would come with the physical discipline. Many of the young adults talked a lot about the negative consequences of having been disciplined physically. So they talk about being very scared. They talked about, and for this one, right, I mean, reading this now, it also kind of hits home, right? So the young adult says that it felt like it was going on forever, and all I wanted to do was to make it stop, right? They also talked about having strained parent-child relationship, right? And I think this was a quote that stuck with a lot of us who read through the data. This person talks about living in the same house as their parents, but living sort of parallel lives and saying that, there's nothing that my parents can do to make me love them anymore. So the best they can do is just keep a distance. I think for those of us who have children, like to think of this, a child thinking of you this way is a very painful thought. Yes, some of the young adults also talk about having their mental well-being be quite severely affected, right? Some of them are in therapy and trace mental health difficulties and struggles back to the harsh discipline they receive as a child, right? Talk about there's not any instructive lesson that's learned, and all of that is just be replaced by hurt and trauma that the parent has inflicted on the child. So to summarize on that quite heavy note, to summarize, I think what we are thankful that the data has shown is that parents use a combination of non-physical, physical, and psychological methods in their parenting. There are a lot of conflicts that parents experience when they use physical discipline. We know that younger children tend to be more vulnerable to physical discipline as well. And there seems to be some intergenerational transmission for physical discipline, right? So this showed up in the interviews that parents talk about there being a generational sense to it, but also in the attitudes of the young adults. There's more part of the more recent data that has been published also looked at whether young adults who have been physically disciplined feel like they would use physical discipline on their children if they were to have children. And the majority of them said that they would. What we found from the data also is that one of the key contributing factors of parents using physical discipline is dysregulation on the parents' part, right? That inability to maintain their emotional control. Ultimately, physical discipline has shown to have negative impacts, and very limited effectiveness as well. So I think this really tracks back with the international literature, right? It isn't just it's not the case that in Singapore, because physical discipline is so much part of our culture, that there's no negative impact on children. Our data at least have demonstrated that there is. I think this will be my last slide. This was a very astute quote from one of our young adults who says that there are many other discipline methods to ensure a child doesn't grow up entitled that doesn't involve physical punishment and doesn't traumatize them, right? So if it's spare the discipline and spoil the child, that's true, but a rod of physical discipline is not the only way to discipline a child. Okay, so with that, I'm going to take a pause here for a couple of minutes to just check whether there are any quick clarification questions about the data that I've gone through so far before I hand the time over to Guan to take us through how some of these research insights have led to some further action. Okay, there was a question in the chat, right? What counts as non-physical discipline? Is it mutually exclusive? For our study, it was mutually exclusive. So non-physical discipline items were things like explaining, offering positive reinforcements. So things that we would think of as positive discipline techniques. In our study, it was mutually exclusive. Oh, yeah, Guan has already sent a response. Thanks, Guan.
Hi,
Okay.
Charlene.
Hi.
I'm not sure if I misheard.
Yeah.
Towards the end, you said that the young adults that you interviewed, the ones who said that, who reported that they were physically disciplined, said that they would still use physical discipline if they had children?
That was from a different study.
Okay.
Yeah. We didn't include that question in our own study.
Okay.
Yeah. Okay, Guan, maybe I'll pass the time over to you.
Sorry, I think Alethea I saw her unmute herself in case we missed that.
Thanks, Ayla. Very sharp. Actually, it is, as I was thinking of asking a question as a follow-up clarification to the discussion, but I'm also happy to sit with this question at the end of the session. So if you rather that, I'll suspend my question till the end.
Okay, sure. Then maybe we can pass the time to Guan first and we'll take more questions at the end. Thank you.
Okay, thank you. Now I'll take the last section from insights to action. So based on the findings just now, right, we are recommending 4 key areas to pay attention to. The first one is to want to increase awareness about the negative impact of physical discipline and discourage parents from using it. Secondly is to support them to regulate their emotions, as you can see that it's a contributing factor to their use. Thirdly, we want to promote alternatives to guide, discipline, and manage children's behaviors. And lastly, to promote an understanding of child development and brain science so that parents can better understand the children's needs and have more age-appropriate expectations. So we are also curious, so we have a poll to ask like which of these recommendations, right, resonate most with you. Maybe you can think about it in terms of which one you like the most, which one you think might be most effective. You can also choose more than one option. So I think Ayla will help to put out the poll. Thank you very much for about 70% who answered. Yeah, so it's like all the ones to, like all the positive parts, the positive practices are things that we are trying to push for and hopefully have some change. Yeah. Okay. So I'll just carry on. So what we were also thinking, right, is that because since a lot of the parents of younger children use physical discipline, so it'd be more strategic to reach out to them. And you'll find that this came in quite helpful in our advocacy efforts too. Okay. So I'm going to share with you our journey that was from 2020 to 2025. It started with a commentary, right? And then it went on to the research study. But there was a lot of other things that came along in the subsequent years that followed. You'll see that bulk of it came like immediately after the study. And then the last years, it was a bit more of a light touch. Yeah, but we also tried to, it was quite widespread, like reaching out to the public, parents, and professionals. So let's go back to 2021. So the commentary, right, didn't just inspire the research study. It will also inspire the advocacy unit to think like, okay, the commentary it's on paper. Maybe not everyone reads it, but how do we further share about how parents can move away, like what was shared in the recommendations earlier? So we came up with this idea of like using a podcast format lah. But I don't think the reach was that wide at that point, but we decided to try using a podcast format to share more about alternatives. So we invited Dr. Kwa So Han and Dr. Chong Hai Shan, both psychologists, and we came up with this like 3-part series. So after the research study was completed, we actually organized a press conference. So here you can see that like we invited journalists from different media platforms so they can interview the researchers, our CEO, our practitioners. And then they published it in all the different news and online news. And there was quite a lot of buzz, a lot on forums as I talked about this. So we were quite happy that it created that kind of buzz and awareness. They may not need to agree on everything, but at least it started causing people to think and reflect and talk about it. So 1 week later, we shared the findings in our 70th anniversary learning festival. And after that, it was followed up by a panel consisting of Jacinth Liu, Stephen Chia, and also Dr. Chong Hoi Shan. So it was quite a lively panel because their topic was to discuss, do you think like families in Singapore can spare the rod? Yeah. After that, we decided, okay, a lot of people nowadays, right, they don't read lengthy reports. They just like short form content. So we turned the study into infographics. Yeah, so this is in the hopes that more people will find out more about read more about the findings lah. Then we were also like talking and working with our practitioners. So you're saying that is there any way to come out with some sort of simple handles, which is not easy because we're not going to prescribe a one-size-fit-all model. Yeah, but some sort of handles that parents can take away about what they can do instead of using physical discipline. So we felt that the understanding of brain science was very important to understand how your brain works, this upstairs brain and downstairs brain, and how they have different functions. But then, because children are still developing their brains, when they get overwhelmed, actually the brain goes to balik, goes out of balance, and they react from their downstairs brain. So this understanding, right, we hope to let parents know so that it will affect how they relate, how they respond to their children. So a lot of parents may want to first like teach them, talk to them, but actually if at that point when they're overwhelmed, actually they're at their feelings brain. So we want to start by regulating their emotions first. Yeah, then relating to how they're feeling to that situation. And then finally by teaching them, reasoning with them so that in future they will not do the same thing. So we wanted to push this out as a approach that parents can use now. In that same year, we used the commentary format again. We wanted this time to tackle misconceptions. So like just now what was said, right? If I spare the rod, will I spoil my child? But here we wanted to share that no, that's not what we mean. Yeah, it doesn't mean giving a free pass on their misbehaviors. Yeah, but it does involve setting clear boundaries, having consequences, etc. There were also other misconceptions, like like just now when Charlene mentioned, I grew up being caned and I turned out fine. But then we wanted to show, like in our study, there were young adults who were affected in their emotional regulation and their relationship with parents. After that, we turned our attention more to professionals. So Hoishan also shared in the Social Service Research Center seminar series, where a lot of social service practitioners will participate in it. We also organized a dialogue on physical discipline. It was attended mostly from the social services and then some from early childhood and healthcare. So we feel that like professionals are also our intermediaries. They also reach out to even more families. So we tried to invite social workers from family service centers, those who conduct parenting programs, yeah, so that they can help to continue to spread the message. We asked them like what do they observe about the families in their use of physical discipline. And we also asked them about the recommendations that they have to use alternatives. So actually it was really common consensus that everyone had, right? That at the end of the day, we want the starting point is how do we support parents to have better capacity, more bandwidth. As mentioned earlier, right? A lot were tired, stressed. So how can we support them? And they were also very clear that we are not here to judge. Yeah, so not being judgmental. They were also very aware that parenting exists in a context. So how can we shift cultural norms towards physical discipline? How do we work across sectors to provide resources? And they came up with some creative ideas like parent education or like bite-sized videos with practical examples. Yeah, that is based on existing research. This was very interesting. So the following year, so we decided that every year we want to do a light touch. So this year we decided, okay, we've done professionals, let's look at parents. And the good part about the study is that it then tells us who do we want to target as a preventive public education. So we were very clear to target parents of preschool children. And we invited our practitioners, Ili and Pauline, to share and expound more on the 3 Rs. But we also wanted to caveat, right, that the 3 Rs is not a quick fix. You know, it takes a lot also for the caregiver. Actually, a lot of change and work is done on the caregivers before you can see changes in the children. But what surprised us, right, was that slightly over 1,000 registered for it. And we were so shocked. Like, huh? And I think we kind of intentionally publicize it as a, you know, that kind of like, ah, yeah, I hit again. Like, so we wanted to reach out to parents who actually don't want to hit, but they feel a bit stuck. So we're so surprised and so many joined in. And we're very thankful that, so we sent out to, other than our social media platforms, we sent out to preschools. And I think a lot of the preschools sent to their parents. And because the parents could relate so much of it, a lot of people signed up. Yeah, in the end, over 370 turned out, which was still very good. So we're still very glad that we could reach out to them. And then this year, we got an opportunity, we were invited by NIEC Research to Practice seminar. So Xiaoling and I shared about the findings. We also invited the preschool educators to suggest any recommendations they can take to partner with parents to implement what has been shared. And then today we're here also at SUSS, the Early Childhood Education Public Lecture Series. So as you can see, right, actually, this advocacy and public education journey, it's ongoing. It will still take time to encourage parents to move away. Maybe it might take generations. But we start somewhere. Yeah. But we also find that the efforts can be multiplied when adults around, parents and children, like teachers, social workers, they're on board on the same cause. So if you forget all else, just remember to stop spanking and start relating. Yeah. So this is we end off this part, and if you have any questions, you can also email ask or ask us.
All right, so thank you very much, Charlene and Guan. It's really a very clear and insightful presentation, given a lot for us to reflect on. Something very close to my heart and probably Alicia's as well, because we teach the social emotional module here at SUSS. Yeah. So I would like to invite the audience. So we actually have a mixed group of audience with us tonight. There are faculty members, students, as well as early childhood leaders and teachers. So we'll open the floor now for some questions and discussions. You can either put it in the chat box or you can just raise your hand, and then I'll call upon you and you can unmute yourself to share your question. But to kickstart, maybe Alicia, you had a question that you were parking. Thank you very much for waiting. So maybe, yeah, you want to start off with yours?
Okay, sure, I will. Thank you, Melissa. And thank you, Charlene and Guan for what's actually I realize is a really difficult hour for me. Just listening to it itself, I just felt a lot of different wave of emotions, I think, passing through. So it's definitely close to heart. And I think one of my questions regarded a bit of trying to understand the data that you were sharing about. But for me, it was more understanding the dynamics of the data, and in terms of understanding that a lot of the parental reports that you were working with were self-reports. And I guess in some senses, when I was asking about mutually exclusive, I was wondering how they would categorize those ideas. But then also I'm thinking from the dynamics of a situation, we know it's never black and white. And so I have a heart behind the parent's heart, as you shared the complexity of what they experience. And so I wonder if, especially with the percentage that you show, that maybe is it the case that, of course, the first step is that non-physical approach to take. Something goes wrong and maybe I'm in that place where I can start with non-physical. And then I'm wondering if it's a sort of mount where I'm trying non-physical doesn't seem to be getting through. And so I need to escalate my response in this disciplinary action taken to get some result, right? Like I feel that, oh, whatever I'm doing is not effective. And so I'm then therefore resorting to physical or psychological effects in the process. So I wondered if then, I guess coming to tones of like, are they in a helpless place by the time they reach that physical or that psychological session, and then you touched on it being a sort of emotional regulation struggle as well. And so I guess that would trying to sort of understand the dynamics, and if you had some insight to the dynamics that was leading to the data that you got.
Yeah, thanks for that question, Lolita. That's a great question, a great series of questions, actually, I should say. So I think maybe if we start out with your initial thoughts and questions, you're asking about how did we kind of categorize the type of discipline that they used, right? So actually, I don't have the specific questionnaire with me now, but if I could just use this chart to illustrate. So actually the tool that we had used, right, had like 32 items there. So each one of these numbers represented a question that were then designed to be categorized into physical, non-physical, and psychological. So like item 1 was something like explain to my child. Number 2 would be offer a reward or time out, things like that. So the categorization was done back end by us. They just needed to tell us how often they used each of these types of discipline methods within the last year, right? So we specifically chose a tool that allowed us to do this precisely because I think in approaching the question of discipline, it's very gray area, and I think parents feel very strongly about the way that they're disciplining their children, and we didn't want to be sitting down and say like, oh, you know, you tell me lah, and then like they feel judged by us, right? So we needed a questionnaire that allowed us to do that categorization on the back end. I think you asked also about parents' sort of narratives. You're absolutely right. A lot of the interviews okay, I didn't conduct the interviews. I read some of the transcripts after. There was a very strong sense that some parents felt very helpless. They felt like they had tried everything, but they cannot get through to their child. Some of it we thought might be unrealistic expectations that parents had on the developmental milestones that their child should be at, right? So, for instance, expecting a quite young child to be able to sit for long stretches for their meal, right? And then, you know, a child cannot, developmentally is not able, but parents don't really understand that, and then are not able to get through to the child. They feel they're not able to get through to the child, and they have to escalate. I think some parents also feel like they're just not able to get a good handle on their child's behavior, and they feel like they have to escalate as well. I think again, the context of this data was collected in like 21, 22. So I think that was just when a lot more spotlight was being focused on parental well-being. I think things have improved since then, or the national conversation has changed. The tone of the national conversation has changed a bit since then. So hopefully parents are able to better prioritize themselves now and you know, give themselves a bit more breathing room. But back then, I think that there was a very strong sense that parents were stressed. They knew that what they were doing is not effective. It shouldn't be done. It damages the relationship with their child. They're very aware of all of these things, right? But they felt like there was still that last thing in their repertoire that they would use if die needed to get the behavior corrected. Yeah. I hope that answers your question.
Absolutely. Thank you very much for that. I mean,
Thank
there's
you.
lots more, but I'd like to hear what everyone else's thoughts are. So
Thanks, Alithia and Charlene. Okay, there's a question from the floor. Okay, from Muhammad. So the question is, if it will there ever reach a stage where policymaking will be required to supplement these advocacy efforts?
That's a very good question. I mean, internally, we've also discussed about it. So, there's the initial slides that Charlene had that some countries had banned it, right? So we also discussed internally. It's like there are different trade-offs. So if you ban it, it sends a very clear signal. It will be a very powerful tool, for example, when social workers work with parents and we go, hey, it's a ban, it's a no. On the other hand, that you get the questions like, if you ban it, then do the parents go to jail? You know, even if you have a law, it doesn't mean the behavior will change. Yeah, so we understand a law is symbolic, but yet while the law is there, it doesn't mean that people will really change. The public education also is needed to carry on such that there's real change at the end of the day. So I would say that if society is going towards a very clear symbolic signal, for me, I would think that yes, that's when the policy making will come in to give a very clear stance. Yeah. But at the end of the day, it still needs to be supplemented by public education efforts. Happy to
Yeah.
hear everyone's thoughts too.
Yeah, if I could add on to Guan Zhen's point as well, I think part of our internal discussions was also looking at the evidence, right? So the evidence tells us that when countries ban first, and that is supplemented heavily with a lot of public education, that tends to get changed the fastest. But at the same time, we also know that in Singapore, we're quite, the way that laws are changed and passed is more conservative. Like there has to be more evidence that the public sentiment has changed. So for instance, if somebody one day did a very robust public kind of feedback or public survey as part of census or something that showed that actually the overwhelming majority of Singaporeans feel that it should be banned, then maybe the policy side, the legal change might happen. So we'll see. And our stance in the meantime is to really still do our best to kind of advocate for children. Yeah, I think we have a question from Grace.
Oh, Grace, yes. Grace, you can unmute to share your question.
So I'm Grace, and just like to add on to Miru's question, and as well as my own understanding of children and how the culture plays a strong role in the way parents discipline. So I just want to like also highlight, I mean, I understand the part where Guan Zhen was sharing about more like round up efforts, where if the more parents do not discipline children by physical punishment, then maybe it will someday hit to the politicians and they will start to change. But what I also want to highlight is there's also a need for top-down method, because not just what the politician says, but as well as what the media has been reporting whenever incidents surface. But the media has a way of like, you know, like explaining why such a situation happened, and then it all goes back to physical punishment is needed, kind of. The narrative has always been like this for a very long time, and when this narrative continues, it's very hard for parents become very confused, you know. I mean, when they hear stories of like, oh yeah, that's why I need to physically punish my children so that they will not become like that. And then like on the other hand, we have a group of us who believe that physical punishment is a no-no because this is what the research says. So for children, not just mixed method research, but mixed method discipline is very, very confusing for children, and it has a detrimental impact on their psychological as well. So this is just what I want to highlight.
Thank you for highlighting that, because yeah, I fully agree. Every time there's either dramas or variety shows that they talk about these, we also pay attention to it, and sometimes you're like, oh dear, they use the Chinese phrase 打是疼骂是爱, and they propagate that message. Then we're like, hey, yeah. So right now I feel like we are living in a very tension-filled kind of space whereby, well, to put it bluntly, as long as there's no law against it, some parts of it will surface, and if not careful, it becomes too excessive. Yeah.
Right. Thank you, Grace. So there's a question from Hui Wen in the chat on whether or not there has been a movement to address the use of caning in jails and by the government, as some of the participants shared that as long as caning is done in jail, it is relevant at home. The government does not seem to be setting a helpful example in this regard.
Yeah, well, thanks for this point. I am not sure whether there has been so on our part, we haven't really tried to advocate for that to be removed within the judicial context. It's a bit kind of further from us. But I'm not sure if there's been any other organizations that have been trying to advocate for this. Guan, are you familiar?
Not so much, but with regards to the government's role, we understood so Singapore has acceded to the UNCRC, the United Nations, the United Nations. Sorry, forgot.
Convention on the Rights of the
Convention, yeah,
Child.
keep thinking committee. Yeah, so in the last round, I think in the committee session, they asked our representatives like, because in the UNCRC, corporal punishment is counted as violence against children, and they very openly ask our government representative about this issue. Yeah, so I mean, at this point, the representative will share the reasons why we still have this, that. But I think it remains a point of contention probably each time Singapore is being reviewed. Yeah. So thanks, Ayla, for helping to translate.
So I have a question. Sparking from, of course, your data that showed about the fact that, and it's a very real experience as a parent myself, right? That many parents describe that they're acting out of stress or frustration, and many actually feel a great sense of regret after. And the poll just now also, one of the highest, I think the second highest, was on supporting parental emotional regulation. That was one of the second highest recommendations from the participants here. So I'm just wondering what your thoughts are on how the community or the workplace can support the reduction of that emotional load that fuels this harsh discipline, right? That comes from parents. I mean, that parents act out on that emotional load. Or if there are intentions to explore that path. Yeah, because I feel, of course, apart from talking to the parents directly from a systemic point, right? The environment that the parents might be in terms of their workplace, or the climate of society as well. Yeah, would potentially play that role as well. Yeah.
Yeah, this is a great question. As I don't really, as you're saying this, right, I'm just like smiling to myself, because I have to admit that at Children's Society, we actually aim to be quite family friendly. So like for myself as well, I feel like I'm quite well supported by my colleagues and my team in this lah. We are partnering with and looking to develop some partnerships with, say, corporate companies to try and do some parent well-being kind of workshops together with them. I think another area of our work, actually kind of tangentially related to this also, is to look at what we can do to help provide activities for parents and children to do together, to also kind of remove them from their typical routines, right? Give them new things to explore together, deepen their relationship, and hope that provides some fun and something different from the regular routine that removes them from the typical stress that they experience. Guan, do you have anything else that you want to share about this point?
I'll start from the starting point of how can parents regulate themselves. So during the webinar session, the 3 R's, right? We also shared it applied to parents. Like they need to first self-regulate themselves before they can apply the 3 R's and co-regulate with their child. So we gave some suggested techniques lah. How do you regulate in that moment and out of that moment? Yeah. So my assumption is that when you as a person learn to manage yourselves better, it will come out whether you're in the workplace, at home, or with friends. So if the workplace wants to support the community, or the community wants to come in and support, perhaps even just general self-regulation workshops, tips can help. So if I can learn to manage my emotions in a very stressful environment, there's probably a higher chance, I'm guessing, that you may do it in other settings lah. So hopefully it translates across. As for the wider context, right? So I think especially I think this came out during the dialogue session with professionals where they talked about how the bandwidth of parents is so taxed. Like it's not just the workplace. They mentioned about how school teachers, maybe primary school teachers, I don't know, also like text the parents, oh, you need to follow up on this, you need to do this. Yeah, so the parents also end up very stressed and wanting to follow up the children on this and that and this and that. So I think we were talking about how can we shift the narrative such that it's not always parents do this to fix your child. Yeah, but instead, how can we support together and it's not,
Yeah.
it doesn't come across as though like the teacher is pressurizing the parent and the parent feel pressurized to do something to the children and then yeah. So we didn't land on any answer, but you're just thinking how together we can reduce that stress.
Yeah, and I think starting that conversation, having those conversations are already important. Thank you for that. Ayla, you have a question?
Yes, hello. So I have two. My first was that I realized after reading some of the the or what you put up from the transcripts with parents and also the comments from the commentary article and also what you've been sharing verbally, there seems to be a lot tied to like how a child's behavior will bring shame or like will reflect on the parents' upbringing of the child. And I hear and then I think back of even when I'm coming home and we're all at the lift lobby, and then the children are kind of dilly-dallying. It's been a long day. They've had a full day of school. They're taking a bit more time to enter the lift. And then immediately the parents are like, can you faster? Why are you so slow? Like immediately it all comes out. But I don't think they would have said any of those things, or they would have been they might not have said it if maybe other people weren't already in the lift waiting. Like they probably would have given more time for their child if it was just them. And I guess it might come back and we were talking about parent workshops and all, but do you also think that, I don't know, I often feel like Singapore isn't very family friendly. Like we rush families and children the way we rush adults. But do you think that also impacts how parents discipline? Yeah.
I'll share a little bit first, okay? So when they were talking, right, one sentence came to me. We also wanted to tell the parents that your child's behavior is not your scorecard. So I think a lot of parents may feel that way, like what you mentioned, that it reflects about their parenting, about themselves. And the other one, yeah, we also fully agree that I mean a lot of times, right, the public and community can be kinder. So if like you see a child in public dysregulating, it's normal. During tensions at a young age is normal. They don't know how to manage their emotions. But then a lot of times you're like, oh, maybe look, and then maybe the parents also feel the stress and the discipline starts to get harsher, basically. Yeah. So yeah, I've talked about how we can play a part as a fellow neighbor, a fellow community member. Yeah.
Yeah, I think to add on to that, it's also what we mentioned earlier, right? That understanding of developmental milestones. Like taking a long time to wear your shoes if you're a preschooler is normal. You gotta figure out how to do it. It's not the easiest. And I think parents also need to understand that, you say one time your child doesn't do immediately what you ask them, it's also normal, right? So I think for us in our conversations, a lot of it goes back to helping parents unlearn the expectations that they have of their child and kind of adjust that to be more age appropriate. I think I like you're talking about, rushing around and all of that. I think it's very common in Singapore. And does that increase the stress that parents feel? I think going back to our data, right, parents do talk about like, if I need to get something done fast, I will use the method that is most effective and the most time efficient for the amount of time that I have. So for instance, if my child, I know if I smack, they're going to spend a long time crying and have to keep sayanging them, then I won't do it lah, right? But if I know that if I smack, confirm will get it done, then they will lor. So I think it was quite interesting that to me that parents are very clear about what is most effective under what circumstances. And they're very focused on getting that behavior, right, at the end of the day that they want, rather than thinking about how to get the child to comply or get the child to the outcome that they want without having to use such harsh methods. Yeah.
I just
Yeah.
want to add also, right, that I mean, we were talking about stress and time. I think in Singapore especially, everyone feels very stressed and feels so tight. But then the challenge is that if you want to, for example, one of the positive parenting practices would be like implementing consequences, right? Yeah. So if you want to, for example, if a child steals and you want to implement a relevant consequence, like getting the child to maybe do housework so that you give them some money and eventually they take the money and then pay back to whoever, it's going to take a very long time. But yeah, it could be very effective because they really learn the impact of how it feels to what the value of money and then what it means to make restitution. But in the context where there's little time, so much stress, it's difficult to really, really teach and take time to teach. So I guess all these adds up.
Yeah, definitely. Thank you, guys. And then one of my other question was, because I think a lot of us who also attended this lecture today, we have a heart for children and working with families and also just understanding their struggles. When you're going through the data, this is more of a personal question. When you're going through the data, the transcripts, I'm sure it feels so heavy and yeah, it really impacts you. What is your process like managing your emotions? Going through all of that with the team.
Yeah, thanks for that question, Ayla. I think this was something that we had to learn to manage as a team as well in terms of us as researchers, right? Because I think for most of us on the research team, we were not really expecting, we were expecting to hear a lot of things from the parents, but I don't think we were kind of ready or really fully ready for how that would have impacted us. I think, and I will say that the data were actually collected by, the interviews were conducted by undergrad research assistants, right? And we had to very closely supervise them. It worked out well that it was the youngish university students who were doing the interviews, right? Because they could go in with that, oh, I'm not a parent, I don't know anything about parenting, can you tell us, right? And I think parents were more willing to let their guard down rather than have, some prof or some kind of grad student go in who are clearly older and then maybe they feel like that they're being judged. But at the same time, I think some of the students needed support to make sense of what they were hearing. And we had weekly kind of powwows as a group to just kind of let it out, or whatever that you were holding and had struggles with. And then we had a staff member also who was available to speak to the students if they needed additional support, if they stepped out of a particularly challenging interview. Thankfully, the interviews weren't that bad, but this actually kind of laid the foundation for the way that we manage some of our other studies where we do talk about quite difficult topics with our participants as well. And I think what was very helpful was that the staff team who worked on the study were very close. So and we're very open about like needing to take time to just kind of decompress after going through the transcripts or just after having research meetings with the data. And that's generally our policy within the team as well. I think for context, we do have several studies on quite heavy topics, including children's mental health difficulties. So if you're interested, we also have studies looking at what children are telling Tingle Friend about their mental health, as well as an upcoming study looking at parents and children's perspectives on mental health and what it means to access services, what barriers they have, what children are struggling with that parents may or may not know. So these were all examples of studies that we kind of really have to struggle with that emotional side. I think as researchers, we're very focused on putting in place all the disclosure protocols, make sure all the research ethics is covered, right? That our participants will get through the study fine. And I think this was one of the studies that really taught us as researchers that we have to put in place a supervision structure to offer that support for our own staff as well. And we're also very thankful and grateful to be part of a social service agency, right? So we have many colleagues who can we can speak to and give us that insight on what kind of supervision structures put in place for social workers, and we kind of adapt and borrow from that to kind of put in place something for our research team as well. Yeah. Thanks for the question, Ida.
All right, so thank you everyone. I think this is definitely an area that's many of us are very passionate about. I'm sure we can go on and on with the discussions in different areas of conversations as well. But I have to unfortunately bring the conversations to a close for now. But I hope that this is something that will keep the discussions going, right? Today, the sharing from Dr. Charlene Fu and Ms. Goh-Karssen has really, I would say, ignited or provoked many different thoughts and feelings in many of us in the various works that we do. So we do look forward to your potential future findings of the psychological discipline that you were mentioning about, because I do think that the effects, not that physical discipline is less of, but psychological discipline is something that many of us may not be aware of, right? Yeah, it's that silent killer kind of thing. So thank you everyone who have joined us. And we do hope that you stay connected with us for our upcoming sessions as well in the SUSS public lecture series. Our next public lecture will be in December this year, and it will be on infant toddlers. So do keep a lookout for our EDM, and we wish everyone a wonderful evening ahead. Thank you, Charlene, and thank you, Guan. Thank you very much. Good night, everybody. Thank you.